Bone marrow transplantation is a complex medical procedure which can save lives of patients who have blood and bone marrow disorders such as blood cancers like leukemia, lymphomas, myeloma, and other inherited blood disorders like thalassemia, and bone marrow failure syndromes like aplastic anemia and immune deficiency disorders. The first bone marrow transplantation was carried out by Dr. Donald Thomas in 1956 in the US. Sri Lanka, however, did not perform bone marrow transplants for our patients. In 2014, I, together with some colleagues, started the first bone marrow transplantation unit in Sri Lanka at Asiri Central Hospital in Colombo. Since then, we have performed almost 100 bone marrow transplants, thereby saving the lives of many. My colleagues from the University of Colombo, the Faculty of Medicine.
I'm Dr. Ruwangiti Sanayaka. From the time I was a medical student and then subsequently a junior doctor in pediatrics at Lady Ridgeway Hospital, I have seen many children with hematological conditions such as transfusion-dependent thalassemia and aplastic anemia suffer due to the non-availability of a cure in Sri Lanka. When I was invited to be the consultant pediatrician to the transplant program at Asiri Central Hospital along with my senior colleagues from the Faculty of Medicine, University of Colombo, I was happy to take it up to help make a difference. And I am happy to say that over the last 10 years, we have been able to cure almost 40 children with transfusion-dependent thalassemia and aplastic anemia.
As an anesthesiologist, I have been involved with the bone marrow transplant team since its inception. My involvement is on 3 occasions. Firstly, when the recipient needs a central venous line placement called an Hickman's line, which is used to give the medications at the beginning. Secondly, if the donor is a related donor, the bone marrow retrieval occurs from that donor. Thirdly, if everything goes well and the recipient has accepted the bone marrow transplant, we remove the line again under anesthesia.
I have been involved with the bone marrow transplantation program, and it's been a great pleasure to be involved in that because, first of all, we have been able to give hope to many patients who were having conditions where there was no hope in sight, and we have been able to help them in a big way. And also, secondly, because doctors and specialists, we have been able to put into practice what we have learned and the skills we have acquired in a low resource settings. We don't always get to do that in our countries.
Hi, it is with a lot of satisfaction that I continue to be associated with the pioneering bone marrow transplant team. I, as a pediatric surgeon, am associated with the surgical aspects of care in children undergoing bone marrow transplant. This primarily involves the insertion and removal of Hickman lines, which are special intravenous cannulas which are surgically inserted into large veins in the neck. And these can be maintained till the end of the procedure. I also attend to any other surgical matters that may crop up in children who are undergoing this procedure.
The bone marrow transplant unit at the Asiri Central Hospital is a classic example of public-private partnership between the academics of the Faculty of Medicine, University of Colombo, and the Asiri group of hospitals. The initiative has brought cures for children suffering from rare genetic disorders and resulted in the establishment of the state-of-the-art Center for Training and Research in Bone Marrow Transplantation in the country.